Hey everyone, welcome back to Azeem USA. If you're new here, hit that subscribe button and ring the bell so you never miss life-saving health information like what we're covering today. Today, we're talking about something that affects over 60,000 to 100,000 Americans every single year. And here's the scary part. For 1 in 4 people, sudden death is the first symptom. I'm talking about pulmonary embolism, or PE. But don't worry, by the end of this video, you'll understand exactly what it is, how to spot the warning signs, and what cutting-edge treatments are saving lives right now in 2026. So stick around, because this information could literally save your life or someone you love. And hey, if you find this video valuable, consider supporting the channel through Super Thanks, Super Chat during our live streams, or by becoming a channel member. Your support helps us bring you more life-saving content like this. Alright, let's break this down in simple terms. Imagine your lungs as 2 big sponges that pull oxygen into your blood. Now imagine a blood clot, usually from your leg, breaks loose, travels through your bloodstream, and gets stuck in one of the arteries in your lung. That's a pulmonary embolism. And here's what makes it so dangerous. When that clot blocks blood flow, your lung can't do its job properly. Your oxygen levels drop, your heart has to work way harder to pump blood, and in severe cases, this can cause your heart to fail. According to the CDC, PE is responsible for an estimated 60,000 to 100,000 deaths in the United States every year. But here's something even more alarming. Recent research published in 2026 shows that despite all our advances, death rates from PE have remained stubbornly high, especially among men and Black patients who face significantly higher mortality rates. In fact, studies show that death rates among people aged 25 to 39 have actually increased from 2.0 to 2.0 per 100,000. That's young, healthy adults we're talking about. Now let's talk about the symptoms, because recognizing these early could be the difference between life and death. The most common symptoms include, number 1, sudden shortness of breath. This isn't your normal "I just climbed stairs" breathlessness. This comes out of nowhere and gets worse when you exert yourself. Number 2, sharp chest pain. Often feels like a stabbing sensation that gets worse when you breathe deeply, cough, or bend over. Many people mistake this for a heart attack. Number 3, rapid heart rate. Your heart is working overtime trying to compensate for reduced blood flow. Number 4, coughing up blood. This is a red flag emergency symptom. If you see this, call 911 immediately. Number 5, leg pain or swelling. Remember, most PEs start as blood clots in the legs, known as deep vein thrombosis, or DVT. If one leg is significantly more swollen or painful than the other, especially in the cough, that's a warning sign. Other symptoms can include dizziness, excessive sweating, fever, and even passing out. The key here is, if you experience sudden, unexplained shortness of breath combined with chest pain, do not wait. Get to an emergency room. You might be thinking, okay, but who actually gets pulmonary embolisms? Great question. Certain people are at much higher risk. Prolonged immobility, long flights, extended bed rest after surgery, or sitting at a desk all day without moving. This is why flight attendants always tell you to walk around on long flights. Recent surgery or injury, especially orthopedic surgeries like hip or knee replacements. Surgery can damage blood vessels and increase clotting. Pregnancy and postpartum. Pregnancy changes your blood chemistry and puts pressure on veins. The risk continues for weeks after delivery. Cancer patients. Both the cancer itself and chemotherapy treatments increase clotting risk significantly. Birth control and hormone therapy. Estrogen-based medications can increase clotting risk, especially in combination with smoking. Smoking damages blood vessels and makes blood more likely to clot. Obesity puts extra pressure on veins in your legs and pelvis. Previous blood clots. If you've had one DVT or PE before, you're at higher risk of another. Genetic clotting disorders. Some people inherit conditions that make their blood clot more easily. Here's something important. According to recent Harvard Health research, you don't need to have all these risk factors. Sometimes just 1 or 2 in combination can be enough. So, how do doctors actually diagnose a pulmonary embolism? The gold standard is a CTPA, or CTPA. This is a specialized CT scan that uses contrast dye to visualize the blood vessels in your lungs. It can show exactly where a clot is located and how big it is. Doctors may also use D-dimer blood test. This measures clot breakdown products in your blood. A normal result essentially rules out PE, but an elevated result doesn't confirm it. It just means more testing is needed. Ventilation perfusion scan, or VQ scan. This compares airflow to blood flow in your lungs. Ultrasound of the legs, to check for DVT, the source of most pulmonary embolisms. Chest X-ray and EKG. These help rule out other conditions and assess heart strain. Once diagnosed, doctors use risk stratification. Basically, they determine if you're low, intermediate, or high risk based on factors like blood pressure, heart function, and the size of the clot. This determines your treatment approach. Now, here's where things get really exciting and why I wanted to make this video right now. Just 5 days ago, on February 5th, 2026, a major announcement was made. Angiodynamics and the PERT Consortium launched the Alpha PE Research Fund, a groundbreaking initiative offering awards ranging from $50,000 to $750,000 to support independent research on pulmonary embolism treatment. This is huge because it addresses a critical problem. We still have major evidence gaps in how to best treat PE in real-world situations. But that's not all. Let's talk about PERT teams, pulmonary embolism response teams. These are game changers. Instead of one doctor trying to make rapid decisions alone, PERT brings together experts from cardiology and interventional cardiology, pulmonary and critical care, vascular specialists, emergency medicine, radiology, hospital medicine, and nursing. According to recent studies from Brown Health, having a PERT team involved significantly reduces 30-day mortality and shortens hospital stays. These teams ensure the right treatment gets to the right patient at the right time. Standard treatment. For most PE cases, the first-line treatment is anticoagulants, blood thinners like warfarin, Eliquis, or Xarelto. These don't dissolve existing clots, but they prevent new ones from forming and stop existing ones from growing. Advanced interventions. For more severe cases, we now have thrombolytic therapy, clot busters like TPA that actively dissolve clots. These are reserved for life-threatening cases because they carry bleeding risk. Catheter-directed thrombectomy. This is where things get cutting edge. A thin tube is inserted through a vein, guided to the clot, and used to physically remove or break up the blockage. This can provide immediate relief for critically ill patients. Improved oral anticoagulants. New formulations in 2026 are designed to be more effective with fewer side effects and less frequent monitoring needed. The mortality rate for untreated PE can be as high as 30%, but with prompt diagnosis and treatment, that drops to around 8%, which is why awareness and quick action are so critical. The best way to survive a pulmonary embolism is to never get one in the first place. Here's how. Stay active. If you sit all day for work, stand up and walk around every hour. Flex your feet and calves while sitting. Hydrate. Dehydration thickens your blood. Drink plenty of water, especially on flights or long car trips. Move during travel. On flights longer than 4 hours, walk the aisle every couple hours. Do ankle circles and calf raises in your seat. Wear compression stockings. If you're at risk, these can improve blood flow and prevent pooling in your legs. Manage risk factors. Control your weight, quit smoking, and talk to your doctor about birth control options if you have other risk factors. Know your family history. If blood clots run in your family, get tested for genetic clotting disorders. Post-surgery precautions. Follow all mobility recommendations from your surgical team. Many hospitals now use preventative blood thinners after major surgeries. According to NYU Langone Health, these simple steps can dramatically reduce your risk. Look, I know this topic is scary, but here's the thing. Awareness saves lives. The fact that major research initiatives like Alpha PE are being funded, that PERT teams are expanding beyond major cities like Boston to community hospitals, and that new treatments are constantly being developed, all of this gives us real hope. According to research published in 2025, global age-standardized PE mortality rates have actually decreased from 3.49 per 100,000 in 2001 to 2.42 per 100,000 in 2023. We're making progress. But we still have work to do, especially in addressing disparities and ensuring everyone has access to advanced care regardless of where they live. The key takeaway? Know the symptoms, know your risk, and act fast if something doesn't feel right. All right, everyone, that's everything you need to know about pulmonary embolism in 2026. I hope this video helped you understand this serious condition and empowered you with potentially life-saving knowledge. If this video was helpful, please give it a thumbs up. It really helps the YouTube algorithm share this information with more people who need it. And if you're not already subscribed to Azeem USA, hit that subscribe button and turn on notifications so you never miss important health content like this. Want to support the channel? You can use Super Thanks right below this video. Join us during live streams with Super Chat or become a channel member for exclusive perks and early access to videos. Every bit of support helps us create more in-depth researched content for you. Drop a comment below. Have you or someone you know experienced a pulmonary embolism? What was that experience like? Let's build a supportive community in the comments. Stay healthy, stay informed, and I'll see you in the next video. This is Azeem USA reminding you, your health is your wealth. Take care.